Recently, many homeowners and landowners in the Northeast have noticed the needles falling off their spruce trees and have been wondering why this is happening. This is often caused by a fungal disease. In this video, we will teach you how to identify the different species of spruce trees that you may have, identify the two most common fungal diseases affecting these spruce trees, and discuss how to treat or prevent these diseases where possible. If you live in the Northeast, there are several common spruce trees that you may find in your backyard or forest woodlot. Colorado blue spruce is one of the most commonly planted trees in a backyard or landscape. As the name suggests, it is actually native to the Rocky Mountains and was planted in great quantities in the Northeast during the CCC era and later. It has a pleasantly fragrant smell and is commonly used as a Christmas tree. This tree has a distinctive light bluish-green to grayish appearance, and the shape of the tree is very conical. The needles of most spruce trees are typically short, about 1/2 to 1 inch in length, and have sharp edges and points. The needles and branches of the Colorado blue spruce are quite stiff. Norway spruce is another commonly planted tree in the landscape. This is also an introduced species from Europe. As the tree gets bigger, it looks distinctive from other spruce trees because the ends of the branches are very droopy. These needles are dark green in color and may be slightly curved. Some other native spruce trees you may come across are white and red spruce, though more so in a forested setting than planted. White spruce typically has a dark bluish-green appearance and may sometimes be confused with blue spruce. It does also have a distinctive, some would say unpleasant odor when the needles are crushed. It has been referred to as skunk spruce because of this unique odor. It also has very short, stiff needles with sharp edges and tips. So now that you are familiar with the types of spruce trees you may have, let's talk about some potential fungal diseases that may affect these trees. Two of the most common fungal diseases are Cytospora canker and Rhizosphaera. Cytospora canker is one of the most common fungal diseases to be affecting northeastern spruce trees. It is especially affecting Colorado blue spruce. Major symptoms of this disease include dieback of the entire branches, starting from the bottom of the tree and working upward. This fungus infects wounded parts of a tree or branch stub, then reproduces by spores which spread by wind or rain. The infection can produce a resin that encrusts the cankers on infected branches, and this resin can range in color from amber to white to bluish white. The fungus can often reside in the tree for years before major outward symptoms become visible, and typically this only occurs when the tree is stressed by drought. Once dieback on the lower limbs is observed, it's likely that the entire tree has been infected with the fungus for years. Unfortunately, fungicides are not a viable option for treating this fungal disease. If caught early, however, homeowners can attempt to prune and remove the lower infected branches and water individual trees if severely drought stressed. Additionally, if spruce trees are planted close together, it is recommended to remove some trees, adding additional space so as to limit the spread of the fungus from tree to tree. This, however, is no guarantee as to any individual tree's survival, since as previously mentioned, the fungus may have already been present in the trees for years. The second most common disease is known as Rhizosphaera needlecast. The symptoms of dieback at first are markedly different from that of Cytospora canker. With the Rhizosphaera needlecast, branches will exhibit dieback except on the newest growth of the tips of the branches, as can be seen in this photo. If caught early, there is a better chance of saving trees infected with Rhizosphaera needlecast than Cytospora. First, as with the previously mentioned disease, prune and remove infected branches. And if possible, cut trees too close together to create space around the healthiest remaining trees. In this case, fungicides may also be applied, starting in spring when the new needle shoots are 3/4 to 1 1/4 inches long, and again about 3 to 4 weeks later when needles are fully elongated. Fungicides with the chemical chlorothalonil would be effective for this disease. And many fungicide products found at the home and garden center near you contain this active ingredient. For smaller trees, a homeowner may be able to apply the fungicide themselves. It is critical that the foliage of the entire tree is sprayed, so for tall trees, a homeowner should consider hiring a local arborist or tree specialist. If you live in Pennsylvania and you suspect your spruce trees of having this disease, but are unsure, you can also send in samples of living and partially dying needles and branches to the Plant Disease Clinic in State College. Be sure to read and follow the directions for sending in your samples. A short video tutorial is also provided on the website. For more information, additional fact sheets describing and illustrating these fungal diseases can also be found on the Penn State Extension website.